All right, I'm here with Paul Conti, who is an expert on trauma. You're a psychiatrist, correct?
Yes, I'm a psychiatrist, yes. Thank you for having me, too. I appreciate it.
Yeah. No, it's a pleasure. I was married to a psychiatrist for 20 years, so...
Wow.
Well, I've got some... Yeah, we're still very, very close. She's a wonderful person. I have a lot of respect for psychiatry.
Wonderful.
Yeah, it's awesome. Anyway, listen, your book sounds very interesting. You're studying trauma. You've been studying trauma for a long time. Why is this your first book?
It is, yes. First book.
And why did you feel compelled to write this? You're a very busy man, obviously. You have a private practice. Why sit down and write a book? I have some sense of how much work that is.
Yeah. You know, I never set out to be a trauma person or to write a trauma book. But over the years of doing what I do, I just saw over and over and over again the impact of trauma. It's like looking for the secret menace behind different disasters that you see around you, or different challenges, or different ways that people are unhappy and suffering, and then looking over and over and over again and seeing the same culprit so many times. And it's not just like trauma itself, but it's what trauma does to us, that people then think differently inside. They think differently about themselves, and differently about safety in the world, and differently about what's possible in the world. And that just promotes so many of the things we try and avoid in life, right? So many of the things that make us unhappy, instead of us being empowered and striving and happy and making the world a better place for us and for everyone else around us.
How do you distinguish trauma from the sort of normal challenges that we face in life? You know, fears of death and the death of our parents, and you know, what's the difference between trauma and just a negative experience?
Yeah. The difference is trauma really pushes our coping skills to the limit, right? And that's most obvious in the case of an acute trauma. Right, someone who's in a bad accident, or someone who's assaulted, we can see that, okay, it pushes the coping skills to and beyond their limit. But that also happens with chronic trauma and vicarious trauma, the trauma we can experience because we can be empathically attuned to other people or to events in the world around us. But it pushes us to the limit and beyond the limit of our coping skills, and because of that, it alters us and it changes us as we move forward.
Interesting. So you frame it as pushing our coping skills to the limit. Are our coping skills as human beings, do you think, is there a constant there, or are they shaped by culture and experience? In other words, I guess what I'm asking is, are our coping skills diminished because we live in a world where we're insulated from so many of the things that people considered part of daily life before? Death, for example, right? Very few people have killed their own food, right? Or seen death.
Right.
Are we softer and therefore suffer more trauma?
I think on the one hand, we are all unique, and our experiences of life and, you know, our defense structure and our coping skills and our interface with the world can be so different, right? You can have two people who, you know, grew up one block away from one another and are completely different, right? So how traumatic things impact us comes through the unique lens of who we are and what our strengths and weaknesses are and what our fears are. So on the one hand, we're all very different, even when we're living in the same culture, right? We often make assumptions that we're more similar than we are, but there's another aspect of that too, which I think you're pointing out, is that the soup we swim in, so to speak, right? The culture that we live in, right, also impacts us all very broadly. And if we live in a culture that is promoting a sense of vulnerability and a sense of conflict and a sense of insecurity and a sense of distancing from day-to-day life, then we set ourselves up, we prime ourselves for trauma to have more of an impact upon each of us, even though we are all different and unique within the culture we live in.
Right, right. So it's almost like the hygiene hypothesis, right? Where because children aren't exposed to pathogens, they end up with autoimmune disorders. Do you think something like that happens on a psychological level where as children people are so protected and so sort of like the promotion of the self-esteem movement or everyone gets a trophy, there are no winners and losers. Is that creating a fertile ground for people to experience more of what we're calling trauma?
Sure, I do think that is one aspect of how we inadvertently prime children for trauma, right? If we shelter children from what I would call rational and expected adversity, like we all don't get a trophy at everything, right? So if we promote a different idea, right, that then doesn't match up with the real world, like wow, we're really setting children up for trauma. Right, but it even goes further than that. Like there's so many ways in which like we don't. In my thought about it is the idea of inoculating or vaccinating children against trauma, right? And we don't do that. I am often struck, and I was deeply struck when I first realized that I was learning things as a second year post-medical school, so postgraduate psychiatry resident, I was learning things that I felt like I should have learned this in elementary school, right? And I really mean that. Like we're not exaggerating.
Like what? What's an example?
So how important, like what our self-talk is inside, right? Like how we see ourselves, right? And like how that plays out inside of us, right? And what impacts how we see ourselves, right? How are the coping skills we foster, right? Makes such a huge difference, right? When we face difficulties, just how the world around us works, right? The idea that say bullying, right? Like people who bully others, right, as children or adults are doing that through the lens, say, of their own problems, right? Which I don't say to like excuse the behavior, but for the person, say, on the receiving end, to see like, why does that person hate me, right? Why is that person so mean and evil to me, right? Because they have a problem. Right? Like there's something wrong with them that needs help and needs attention. There's some desperate insecurity that leads this person to be aggressive, whether it's a bully on a playground in middle school, right? Or it's somebody bullying someone else from the sense of racial privilege or socioeconomic privilege, right? Like there's a lot of bullying that goes on, and people, we take it so personally, right? As opposed to thinking like, look, people do things like this because they themselves are hurt. And like that frees me from having a sense of like the intrusiveness of what someone may be saying, right? So the fact that we don't learn these things, that we don't teach in childhood, right? The knowledge, even the basic knowledge and the skills and aptitudes and thought patterns, right? That like how to attribute something to self or other, right? That would be protective. And I think we leave children at best very minimally protected, at worst set up for trauma through the ideas that you were citing earlier.
Yeah, that's interesting, and that sort of intersects with something I've been thinking about a lot recently, which is the absence of how can I say this? Like the absence of coming of age rituals in Western societies, the absence of a clear delineation between childhood and adulthood. I've studied hunter-gatherer societies for a long time, and it's very clear in a hunter-gatherer society when someone goes from being a child to an adult, both for men and women. In fact, in many of them, they receive a new name, and there's a separation from the group, and then they return with visions, and the shaman will go through the visions and help them sort of plot out the course of their adult lives in a way, and they're expected to behave differently. And, listening to you talk about, this example of something you're learning as an adult that you should have been taught as a child, it just strikes me how we let children continue to be children right through their lives in a way, right? Which, as you say, leaves them very vulnerable.
Right. That's right. There was a time in my career when I did a lot of work in nursing homes. right? And I covered 12 to 15 nursing homes in one area, and I was struck by something I hear in medicine and I would hear from other psychiatrists, which is that like life is always the middle school playground. Right, that plays itself out, in corporate offices. Right, it plays itself out in family homes between adults, and I would see that it plays itself out often in human dynamics in nursing homes. There's the cool people at one table and people who are marginalized at another, and I say it to point out, I think, the truth of what you're saying, that like if we don't learn things, we don't learn things, and then we can carry the deficits of not learning those things. So the person who feels bad that they're excluded, right, and they feel that, in the sort of last stage of life, right, because the same human dynamics are playing out that played out when they were ostracized on the middle school playground. It's just one example, but it's an example of exactly what you're saying, that if we're not taught things, we don't learn those things, and that we don't have the kind of rituals that mark not only our privileges but our responsibilities, right? Like I mean, I wonder if you'll agree with this, but even like the idea of like getting one's driver's license, right? If you think about like what a responsibility that is, how many people are hurt or killed in cars, right? But I remember how badly I wanted my driver's license, right? And I was and like I saw it as only one thing, like I get something, right? And look, when I was 17,
right.
18, 19, I wasn't super responsible. I think not very many of us were, right? Because we saw that as just something I get. I turned 17 and I go take that test and now I get something, right? Not a sense of responsibility, right? Not a sense of a group dynamic, right? And I think we see that in the world around us now, where there's not even a sense of responsibility amongst people who are very powerfully positioned in the world around us. There's not even a sense of responsibility about like the facts, right? Like, we can't agree
right.
on whether like 2 is more than 1, right? And if we don't even recognize it, like, hey, if I'm the person who wants my side to be 2 and my side is 1, if I don't even feel the responsibility to acknowledge that 1 is less than 2 and 1 is what I've got, right? Now, maybe I'll still argue my point and I'll redouble my efforts, but can I at least argue that there's a truth in front of me, right? If we don't even feel that responsibility and we see the powerful figures in the world around us, right, acting that way, what are we teaching children? Right? We're teaching there's no responsibility for anything. Right? And that's very, very dangerous if you think about how we've responded to the pandemic, the erosion of faith in our socioeconomic foundation, right? The impact of systemic racism and exclusion of people for all sorts of reasons. That if we can't even look at that and say, here's what the truth is of it, like, how are we going to find our way forward? That starts to get scary. If hunter-gatherer societies did that, well, everyone would die. Right? I mean, they can't do that, right? So they don't do that, right? But in a sense, we have the luxury to do things that are dangerous to us, that denigrate us. We have the luxury to get away with those things. But if we get away with them for too long, we won't have the luxury anymore, and then we're in real trouble. And that may be now.
Yeah, it certainly feels like it to me. You were talking about bullying earlier, and and the middle school playground, that clearly seems to be what's happening in right. Washington, and also on Wall Street. I mean, there's no sense of responsibility in economics, and it's a strange thing because, here I wanted to push you a little bit on trigger warnings and safe spaces, sure. and obviously, exploring this sort of overprotectiveness, but at the same time, I feel like there's a lack of decorum on a national level. So it's almost like we're hyper protective on a personal level, but on a national level where anything goes, or on an economic level. I wonder if those things are related somehow.
I think they're related through the lens of hypocrisy, right? I think that is hypocrisy writ large, right? And I think it fits with like the ideas around sort of cancel culture, right? That, I don't know, it was a little while ago where there was some, I don't know who it was, but somebody who was like a slip of the tongue, or who knows what happened, but the person said a word that they shouldn't have said, right? And for all intents and purposes, like, I mean, my read of the news I saw was it didn't seem like that was a bad person, or like, like it didn't seem like it was a slip. It just seemed like a mistake, or at least like one couldn't look at it and call it something different with any surety, right? But that's not, the person was treated as if they'd done something awful, right? And there's a hypocrisy to saying, we're looking around with vigilance for anything somebody is doing wrong, right? Right. So we want to be overprotective in that sense of children, right? We don't expose them to anything negative. Somebody makes a slip of the tongue and says something negative, or there's a wardrobe malfunction on television. Like, oh my gosh, like let's go get that person who's done something so awful, right? And I think it's precisely that hypocrisy, because it is the opposite, right? But it gives the illusion of like, oh, there's something we're paying attention to. There's something we're being diligent about, right? And what we're really doing is allowing this bigger picture of bullying to play out, right? Whether it's someone who wants everyone to think and act exactly how they think is right, or it's someone who wants to do things that are completely outside the pale of reasonable behavior, right? And sort of and pretend that's right, right? We have a lot of then emperor's new clothes going on, right? Like, let's not look at what's going on over there, but we're going to be really meticulous about, oh, this person who had a slip of the tongue, or that person, or these small things. We're going to protect all these children, from like having to face that real life has competition in it, right? But while we're doing that, right, it's sort of like people talk about the idea of rearranging the deck chairs on the Titanic, right? That like that's a lot of deck chair rearranging, when like we may be sinking the ship that we're all on if we can't be honest and reasonable and have some interactions between us that are grounded in being honest and reasonable, even if we disagree.
I feel like I resonate with everything you just said. The one word that jumped out at me was the word allow. You said we're allowing, the bullies in Washington to take over. We're allowing a particular news channel, news in air quotes, of course, to promulgate all sorts of nonsense and be taken seriously. But I wonder if it isn't also a question of people feel helpless. They feel like we can't control what's happening in the economy. We can't control what's happening in politics. We can't control what's happening in so many different levels of institutions. And so it almost becomes like, sacrificing virgins in the volcano to appease the gods. There's a disconnect between what we are doing and what's happening, but we're trying to, ritualize some sort of insistence upon a certain kind of behavior as a way to affect, on the micro level, as a way to affect the macro level. They're disconnected completely because they don't care.
Right.
Hedge fund managers don't give a damn what we think about them. They just want to control the tax system to their benefit. But it kind of feels that almost like, the Puritan witch trials and stuff like that, where there's this sacrifice of the innocents in order to appease the gods.
Right. No, I think this is a great question. I mean, you're bringing out like these like really important concepts that are hard to capture, right? But I think the answer to that is like that sounds in a sense so complicated, right? And I think like this is part of why it's so hard, right? Because we feel disempowered and detached, right? And we feel lack of control, and then there's a tendency to just ally with whatever it seems like might be most helpful to me, or to run away from it all and hide, right? And I think that's because that way of looking at it, which there is truth to, but it makes it too complicated. What we're doing is missing the simple, right? And I think that's the answer, that good mental health on individual levels, and I think on sociological levels, right, it comes through the lens of simplicity. Now, just because something is simple doesn't mean it's easy to achieve, right? But the concept, I think, is not complicated. How we take what you just said and we take it away from something that's so complicated that we're all disempowered, and my goodness, what's going on that we can't control, and we change that dynamic is through the lens of simplicity. Like, what if we insist upon accountability to truth and to some basic principles, right? So the rubber hits the road if you say you're an advocate for me, right? You're representing a political opinion that I agree with, right? And you're going about it in a way that's wrong or dishonest or bullying, right? And I say, like, I don't want that. I don't approve of that, right? Like, that's not how I want. I'd rather have my needs not met, right? If I'm for policy A and you're going to lie and push and bully and torment people and do things that are underhanded to get that done, I'm okay with not. Right? And that's what I think. I think most people in this country are reasonable, well-grounded people. You know, if you just go door to door, you find people who can attach themselves to some basic values and expectations and who treat their neighbor that way. Right? You know, if I want to borrow an egg, I'll give you an egg back tomorrow. Like, pretty simple, pretty straightforward. Thank you for loaning me the egg. Right? And I think if we ground to that and we say, look, we would take away then the incentive to do these things. You know, people who behave this way, their products wouldn't be bought, right? People who behave this way won't get reelected, right? And we can ground to the simple truths that we are telling, like, for our children in their early education, right? We are telling them in early education the basics of being polite and being reasonable, and, you know, don't take something from someone else, right? If you took something, say you're sorry and give it back. Like, you know, be open, be honest, right? Do the right things, work hard, it'll get you ahead. Like, we do try and do that, right? I think in early education, we may be overprotective too, but we do that. And if we grounded ourselves to an insistence on these basic principles of early education and accountability, I think we could change it all. Because now, you know, we don't want to buy what someone else is saying, even if it serves me, if it's wrong or you're bullying your way to get it, or what you're going to do to make me money if I'm investing with you. Like, if I look at that and I think that's not right, well, how about I just say no? Right? And like, that's actually easier to do than we might think.
Well, yeah, I guess it is. But I mean, it's so hard because our economic value structure has diverged from the ethical value structure that you're talking about, right? You know, in grade school, you're taught to share. You know, if you don't have enough for everyone, you don't bring it to school, right? But in business school, that's not what you're taught. In business school, you're taught to hoard and get a monopoly and drive out competition, and this sort of ruthless celebration of selfishness is celebrated and rewarded in large segments of our society. And so, you know, we sort of set ourselves up for a conflict. And I guess what we're really talking about, people might be listening to all this and saying, what the hell does this have to do with trauma? But I think what we're talking about is we live in a society that is itself traumatized.
Absolutely. Yes, it's trauma that distills down to, like, I'm powerless. I just have to get what there is for me, right? I need more and more and more, no matter what it is, right? Like, it's trauma that makes that desperation in people, and it's also trauma that drives us to untenable places socioeconomically, right? Like, it is traumatic for people who work in entire industries that they can't make good livings, right? And like, we need to say that that's not acceptable. Right? Like, we talk about, okay, no, we don't want to pay more for gas. Like, okay, like, I understand no one wants to pay more for gas. But if we look at, well, what are we paying for? I don't want to pay more for gas if it just goes into someone's pocket who already has $1 trillion, right? But I'll pay a little more for gas if it helps the people along the line, like, make a decent living, right? So, you know, we look at these endpoints that come from places of desperation. If I don't have enough money for food, and I just want to pay less for gas, and I don't care about what's beyond that, right? But if we can free up the privation that oppresses us and then leads to this traumatic mindset, right? You know, it's a mindset that things are not going to be okay, and I'm not going to be okay. And how many people feel that? Whether it's because of, you know, there's violence in the home or violence around them, or various aspects of oppression and abuse that they can't get away from, or if they're disempowered in the world around us because of their socioeconomic position, or for many, many other reasons. And that sense of being beleaguered and desperate, right, leads people to think, like, look, I've got to just take care of me, right? And like, that's what I got to think about. That's what we come to as humans, right? But we don't have to live that way. I mean, if you think about how much plenty we have, and we can have a bunch of social guidelines that are in accord with reasonableness and truth. Like, you know, most people want to do what's right in the world. They don't want to look to get every cent they can, even if it comes at the expense of somebody else. Like, you give people enough and the ability to work a little harder and do a little more and get ahead. And like, we can actually do that, right? We don't have to be in this place of desperation, which comes from trauma that we've experienced now in a lot of ways for a lot of years, that has this country in a very different and very beleaguered mindset.
I'm gratified that you are so open to seeing this through a political and economic lens, because I thought that you were going to, stick to a very medical paradigm, and for me that's a little frustrating, because I feel like the medical paradigm is important, but you're treating people who are victimized by the world that they're living in. And, as I mentioned before, my wife being a psychiatrist, the worst thing in her experience was trying to help someone and then sending them back to a dysfunctional family setting, for example, or a job that was humiliating and disempowering and toxic. It's like, how, as a physician, how do you heal someone who's swimming in a poisoned river? It's so I'm really happy to hear you talk about these things in a much more holistic way. Well, I appreciate that.
And I appreciate you taking note of it, right? And pointing out even your wife's experience as a mental health practitioner, right? That we work in these systems that are so siloed, right? Our care systems, right? Our medical systems, our mental health systems are so siloed that they often don't look to actually help us. Right? I mean, there are many, many systems where, you tell someone some tactics to decrease their sense of tension inside, et cetera, and you send them back to the same abusive place, and we can check a bunch of boxes on some electronic chart, right, that says that that's okay, and that's what was achieved during the 12 or 15-minute appointment, right? Same thing in general medical settings where people present with 5 problems, half of which are driven by mental health problems, right? And we don't want to look at that. The same way that we don't want to look at where do our problems come from. Right? If half or more of what people bring to primary care doctors comes through mental health problems, right? And all the people we're coming to mental health care for is coming through the lens of mental health problems, how can we look at that without looking at, again, I come back to the soup we're swimming in. It's an expression people said when I was a kid, like, you can't understand anything unless you look at what's the soup that person is swimming in. So we have to look at the politics. Right. We have to look at the socioeconomic situation. Even take something less dramatic than abuse. If you feel like I'm working really hard and I can't get ahead, right? I'm living paycheck to paycheck. I can't get ahead. How does someone feel better? How do you help that person with their depression, right? And we need to step away from this silo effect where the people who are involved in mental health care are often run so ragged by the systems everybody works in, right? Hence this term burnout, which I think is like not the right term because it implies there's a fault in the practitioner, in the doctor, or in the therapist, or in the nurse, right? As opposed to saying, how about people who work in these oppressive systems that are just bullying them and grinding them down while they're not giving good care to the patients, while everything is siloed in a way to make a bunch of paperwork that says it's all okay, and nowhere do we actually meet the real world people are living in as they're trying to understand themselves and solve their problems, which is why this idea, and I write about it in the book and I talk about it in my clinical work and in my consulting work, of like helping people make a true life narrative, right? Because like this is a way we can start this even outside of systems of like, what is actually my story, right? A lot of people, I see this over and over and over again, of people have stories in their head that are unfair stories created by trauma that say how they're not good enough and how they failed, right? And it doesn't acknowledge that, oh, look what happened to that person who escaped from, something so difficult and is working so hard to make ends meet. Like, people often have so much to feel good about and be proud of, but the internal dialogue is shaped by trauma and by traumatic things. And often what's going on inside is telling them the opposite. So, we can empower ourselves to be healthier in our own lives and healthier for the people around us and healthier on those bigger levels, right? Because if I don't want to accept the lies that trauma tells me, right? My own trauma tells me how inadequate I am and I'm never good enough and nothing I do will ever really make a difference, right? Like I have that inside of me from trauma, right? But in trying to fight that, right, I help myself. I'm better for the people around me. And then I can say no if some investment opportunity, I'm not quite sure if it's sketchy, right? I'll say no to that, right? Or some way of treating other people, right? Like I'm much better to advocate for what's right and take a stand for truth on those big levels if I'm taking care of myself on the smallest level, which is inside of me, the one-person level inside of myself. That's how we knit together the truth of it all and how the socioeconomics and the politics and the medical aspects, it all comes together, what in real people that we are far too often just simply not recognizing.
How do you deal with the contradictions within your own life? The fact, for example, you went to Stanford, you went to Harvard. That's a pretty high stress path to take, right? There's a lot of sort of built-in chronic trauma there. A lot of medical school. I'm always struck by the fact that doctors are advocating, you should get at least 8 hours of sleep every night. You should have as little stress in your life as possible. You should pay attention to your relationships. And then they go to medical school where they're, working 18-hour shifts or 24-hour shifts. There seems to be sort of a built-in chronic trauma in the medical education.
Absolutely.
Right? Like, it's crazy. I don't understand. Why is medical training still doing that? Being able to make good decisions without sleeping for 24 hours is not a skill that anyone should be cultivating.
Yeah, the medical education system, which extends forward to the purveyance of medical care, right, to the systems that then doctors work in after medical school, has tremendous flaws. I mean, there may be reasons to say in the learning phase to see patients longitudinally, say over 24 hours, right? Because there are things, but then to give the person sort of rest, like not to say, okay, after 36-hour shift, you come back 12 hours later, right? So even when there are reasons for the longitudinal things, it doesn't have to be combined with things that are sometimes sadistic and sometimes just simply inane. Right? Like, a part of what we learned, not always, and I was fortunate that this did not pervade the education that I received, but was present at times in it, of this idea that, you should be embarrassed or ashamed if you don't know something. Like, so imagine, now you have students, right? Like, of course you don't know things. That's why you're a student, right? But if you say, like, I don't know that, there's like, there's a sense of shock, like you've uttered profanity in the middle of church or something, right? Like that's not okay to say. And like, think of the culture. What is that saying? It's saying you are inadequate and you should be ashamed if you don't know an answer. And obviously, there are times you don't know an answer, so just make something up. Right? Instead of the shared humanness of there are times we all don't know answers, right? And we can think more about them. We can figure things out, right? I can not know an answer and maybe not be ashamed of it, but know, like, I'm going to go figure out the answer, right? And like there's an element of humanness that involves also meeting people where they're at. Like, people come to care, often with me or with the other people in the group of practitioners. We all work together, right? They come and they don't know the answer, right? They're scared, right? They want help. They feel embarrassed or ashamed that they need help. And if we can meet them in a human place that says, look, I'm not, in a sense, portraying I'm superior to you and I have all the answers. Like I'm a human being with his own problems too, right? And I go get my own help to figure them out. Right, and then there's a shared humanness to that, and I want to know everything that's going on with you. Right, I don't want to try and help you feel better if there are other things in your life that need to change for you to feel better. Right, like we don't have a process of realness, and how could we have that in a system that wants to pretend like we can throw medicines at everything? Right, I mean, how many times I've seen that the answer was throw medicines at that person's depression, throw medicines at that person's panic attacks, right? Instead of like, well, they're depressed and having panic attacks because of X, and X is something like really awful that needs to be addressed, right? I mean, it's actually not that hard to marshal these resources in the world around us. We're so mired in the paperwork and in the things that cost so much, right, in our health system, that we don't do the basic things of like just resources to help people, other well-meaning human beings, right? Real psychotherapy that gets at what's actually going on inside of a person, which ultimately again comes back to my message: is this all comes to recognizing trauma and the ways that we can intervene in trauma, which is actually not rocket science. I mean, that's part of the message in my book, is this is not that complicated. I'm not taking some subject and then looking at it in some esoteric pie in the sky way. I'm saying, look, let's look at this because this is real and it's impactful right now. And there are things we can do to change it, like today.
It's interesting. The subtitle of your book is The Invisible Epidemic.
Yes.
Is that right? Trauma, the Invisible Epidemic. Exactly. It's interesting because it's a form of invisibility that is due to the fact that it's omnipresent.
Uh-huh.
You know what I mean?
Right.
It's like it's invisible as the air in some way. It's there everywhere, and so we don't recognize it in a way. And the more we talk, the more I'm thinking about how trauma is sort of like inflammation in a sense, that it underlies so many other diseases and disorders. They're either caused by it or made worse by it. And also, you said something earlier. You used the term empathic trauma that I thought was very interesting. And this all ties back into how if we're around people who are traumatized, then we ourselves, it's impossible to be healthy if the people are happy if the people around you are miserable. And I feel like that's another thing that's missed in American culture and all this individuality. Right. People think they can, it's like the people who think they can build a shelter and stock up on canned goods and guns and they'll survive the apocalypse. And they're not understanding how entwined they are with other people. Right. You're not going to survive alone and you can't be happy alone. Right. And that's not really a question, but it's something I was thinking about while you were speaking. Right. You also distinguish between chronic trauma and acute. And I was thinking about a book I read a while ago called A Paradise Built in Hell by Rebecca Solnit, which really interesting. It's about disaster sociology. Okay. And so studies of how people behave and experience acute disasters. Okay. So war, earthquake, flooding, something like that. And what they found is that people often look back on those experiences as the best time of their lives.
Absolutely. There's a difference between, acute trauma, say, is something that happens acutely, right? So if someone, bursts through the door where either of us are and attacks us, we're acutely traumatized. We don't expect it. It's shocking. We get hurt, right? That's acute trauma, right? But high intensity situations, right? Disaster situations often give people the opportunity to distinguish themselves, right? To behave in ways that make them feel proud of themselves that they didn't have before. I mean, I've often said to people who can't tell me one good thing about themselves when I can see wonderful things about themselves, and they can't tell me anything good about themselves, and I'll bring the conversation around. If I could snap my fingers and you could be in a disaster zone, right? You could be it would fix all the problems, right? Because I know the kind of person that person is. That person would want to help. That person would marshal their resources. Would start to look at who's worse off than I am, that needs more. That person would show themselves all the things I know about them because I see them from the outside, right? They don't know about themselves, right. And what else is going to blind you to good things about yourself that someone can obviously and easily see from the outside? It is only trauma and the evils of trauma and the shame and everything trauma brings that the person wouldn't know that. But you give that person an opportunity, and I have seen that in my clinical work over the years where an opportunity like that arises, right? And that person then, what they do in that opportunity is they be in the active sense, right? They are being who they are inside because they're given an opportunity to do it. That's very different. And we don't often enough give people opportunities for good, robust experiences that can make them feel better about themselves. Experiences in the communities we live in. We don't need an earthquake or a disaster to do that. Right? But we don't have social structures that glorify that. We should have social structures that glorify that, right? If you're worse off than I am, let me go out this weekend and do something for you, right? There's not nearly enough of that in the world around us.
Well, and the great tragedy is that so many of the people who have the most resources, right? I wrote a book called Civilized to Death, and there's a chapter in there about what I call rich asshole syndrome. And it's the idea that most people think that people become people who are obnoxious, who sort of step outside of the expectations of society, are better at becoming rich because they're willing to make those bad decisions or cut corners. What I was proposing is no, being very wealthy is psychologically difficult because as human beings, we are not designed to have much more than other people. Our evolution has led us to expect that we all have the same and we all share. That's how we survived for 300,000 years. So it's psychologically traumatic to have more than others. And I experienced this the first time I went to India, and I was sitting in a restaurant, and there were street kids standing next to my table staring at my food. And there was this helplessness. How can I help them? How can I can't solve this problem. There's nothing I can do except develop scar tissue and go on with my life and step over the bodies, you know? And I think that is so painful for people, and they don't, because of what society teaches us, people don't understand that the best way to feel better is to help someone else. It's not some, it's not some erudite Christian teaching. It's basic human evolution. We survive by helping each other and being integrated.
Yes.
So how do you deal with, when you're dealing with a patient and they're unhappy, they're maybe even suicidal, and you see that they're socially isolated.
Right.
There are no pills you can give them to solve that problem.
Although in America,
how do you?
In America, you're most likely to get pills, right? And there are no pills to solve the problem. Yeah. Right. So there are answers to that, which I think the answer is we root back to the simple, right? So the problems surrounding money. Right. I'm fortunate and privileged to work, and it's really true, with people across the socioeconomic spectrum, right, from one extreme to the other and all in between. And what I have seen over and over and over again is the further you get from kind of the middle of the bell curve, the more money contributes to psychological problems. Right? So too little of it there's distress, there's vulnerability, right? When there's too much of it, if there are underlying problems, that sense of responsibility, a sense of how to be in the world. So money at both ends of the spectrum can exacerbate mental health problems. And I have seen that over and over again, right? But what's interesting is you do the same thing across the board, is you ground a person to the just, in a sense, it's the basic. I love that you use the word evolution. I think that's true. It's evolutionary common sense, right? That it is good to do something for others, and people can do that no matter what. The person who feels paralyzed by wealth and what to do with it, and a sense of shame about wealth, and it fuels depression. It's a scenario I've seen, right? Can go get out there and do some one direct good thing for one person. Start doing that feels better, and often that leads to interesting ways to use money for a good purpose, right? Someone who has no money whatsoever can still offer someone a hand, can still offer someone a compliment. And it may seem like, oh, that's hokey, but it's not, right? It's the basic simplicity of our evolution that tells us, that's what makes us realize that we're worth something. We have value inside us. Even the idea of giving blood, right? Someone who recently was having trouble understanding their worth and trouble seeing that, right? Despite having a million wonderful qualities, who then gave blood and realized, look, I'm doing something for someone who's going to get this blood, and if this is in me, then it's also in me to persevere and to be a good person in the world. And there's a simplicity to that we're so far away from, that we inadvertently perpetuate our problems by not realizing what is sort of greases the wheels of progress in ourselves and in our societies. Yeah.
I was reading in the notes for your book that you connect trauma and shame, and shame sort of turbocharges or fortifies trauma in many ways. And I was thinking about a paper I read years ago, written by an anthropologist in Papua New Guinea, and is a woman, Australian woman. I forget her name, but the story is she's there in this village in the hinterlands, and she hears a commotion at night and some yelling and thumping, and then it dies down, and she goes back to sleep. And in the morning, she gets up and she goes down to the river, and women are doing some wash by the river, and they're talking about what happened the night before, which is that a man snuck in through the window of one woman's hut and climbed into bed with her. And when she woke up, she was shocked, and she said, get out of here. And she pushed him, and he fell in the mosquito net and tripped and fell out the window. And they're all laughing. And she said, the anthropologist said, why are you laughing? He wanted to rape you. And there's no word for rape. So she had to explain what she meant. He wanted to have sex with you, and you weren't interested. Yeah. And the woman in question looked at her, and she says she looked at me with a mixture of confusion and sadness. And she said, well, how could he hurt me? It's only a penis. And so the rest of the paper, the author is exploring the idea that we have weaponized the penis and the experience of rape by applying huge amounts of shame to that experience. Whereas in a culture that doesn't apply that shame to the experience, it's not that the amount of trauma is negligible compared to ours. It's similar to research showing that children who are sexually abused in a way that isn't physically traumatic, it's just, their uncle touched them in a way that was inappropriate, they experience the trauma when the adults find out and everyone freaks out.
Right. Okay, I understand.
That's where the bulk of the trauma, because then it's a social shame situation. So I guess what I'm getting at is, how do you see shame and trauma interacting?
Oh yeah, I think shame is trauma's top henchman, right? So you can't talk about trauma without talking about shame, and shame ushers in all the other problems. Right? So what is the poison here, right? The trauma makes the poison, but the poison is the shame, right? And I think the stories you're pointing out are I think speaking very strongly to how we misappropriate shame. We misapply shame, right? So do we often apply the shame is felt by the person who is raped, not by the person who does the raping, right? Like absolutely, that is tragic, right? I mean, it's terrible that could be the case. Right? And I think what you're pointing out, and I don't know the specifics of what actually happened to the woman in Papua New Guinea, right? But it's interesting, right, that in the beginning when you're telling the story that the anthropologist told, right, the women are laughing, right, and they're laughing at him, right? And so what that makes me think, and I don't know the whole story, so I'm not sure, is the shame then being applied in a sense where it belongs, right? Like, who's got something to feel ashamed of? The guy who climbed in somebody else's window, right? And the idea that we don't apply shame, because shame is very, very powerful, right? That's why it's evolved in us, right? Shame really changes behavior, right? But trauma hijacks shame and uses it against us, right? So that this, I think, you're using a great examples, because if someone is attacked or is assaulted, right, it triggers automatic shame, because that's the societal soup that we swim in. Right? And then often our helping mechanisms, helping in quotes, reinforce that shame. Right? And we do that all the time, even in mental health. If something didn't work for someone, we talk about how they failed it. Right? Or that person failed CBT and Prozac. Right? What does that mean, failed? I mean, that implies that what was done should have succeeded, right? And you failed it, right? Instead of maybe we applied something inappropriate, we make shame through our helping mechanisms more often than or at least as often as we do good. It's not clear to me that the big systems of help we have in mental health are not doing more harm than good. They may be. I mean, in some cases they help, right? But in some cases the systems themselves, even, I'll tell you a side I think is really important, that there are times now I don't send someone to an emergency room, right, when they're in a mental health crisis, right, where 15 years ago I absolutely would have sent them, and I would have considered it wrong, even malpractice, not to have sent them. Right? But now the risks are so much higher. You send somebody somewhere, they're waiting for ages, right? Then they go to some mental health room where they're basically stripped and put, even if there was they didn't say anything that would make one think that should be the case, right? The process of the invasiveness, the stigma, it's not this way everywhere, but I believe it is this way most places from coast to coast, where I think, it's a roll of the dice now, that if I send that person for urgent help, in some cases, I feel that I am more likely to do harm to them than I am to do good. So I don't send people for emergent help when only even 10 years ago, maybe certainly 15, it would have been so wrong to not do that. I mean, so you think about, that's not that long a period of time for our helping systems to have degraded so much. And I think there's been a lot of degradation over many years. But to me, that is shocking as a psychiatrist to say I often can't send people to emergency care because I'm worried after that experience, to say they're suicidal, are they going to be, how are they going to feel after that experience? When they're discharged, nothing has happened, it's 18 hours later, except they feel worse about themselves. I put them at greater risk. And I think that's an example of how we hijack shame and use it against ourselves as a society when we're most vulnerable.
Yeah, that must be very frustrating for you to be working within that system. I'm reminded of the research. I can't remember who did it, but it was someone. I think it was at Yale. 20, 30 years ago, the professor, as a sort of an experiment, I don't know if they were postdocs but it was a psychiatry class. He had them go to a psychiatric center saying that they were hearing voices and they were feeling self-destructive, and they were admitted, and then 24 hours later, all the students said, okay, this was an experiment. I feel totally better now. Everything's fine. And they wouldn't let them out. The psychiatric center refused to believe them. So once they admitted that, once they presented as having any sort of self-destructive thoughts or psychiatric disorder, the system is set up in such a way that you're stigmatized and you're essentially trapped. Right. You know what I'm talking about? Have you read that paper?
I don't recall the specifics of it, but yes, the general concept, yes. And I would say this is, I think today you would have a different problem, right? That a person would present saying, "Hey, I'm sick and I need help," and would say all those things and have trouble getting help in the first place. Right, so they'd be equally stigmatized because now what's attached is something that is that ultimately people look at in a stigmatizing way, and you can't even get in the door to get help. That's why I sat in a waiting room. Then they put me in another room. Somebody saw me 8 hours later. Then another 8 hours later, and then ultimately you come out, and it's not that you can't get out once you get in; it's that you can't get in even though you need help.
Right. You know, when you mentioned empathic trauma earlier, I was reminded of a friend of mine. When I was doing my PhD in psychology, I started off doing research on oncologists and intensive care physicians, and I wanted to. I was studying burnout, you mentioned earlier, and I wanted to understand why some personalities are better structured to withstand the sort of existential despair of having most of your patients die. Some people can do that for the duration of their career, and others just can't handle it after a while. So that's what I was studying, and I ended up switching because it turned out I wasn't well suited to spend a lot of time in oncology wards. But I have a friend who was a tattoo artist, and we were talking about my research one day, and he said, tattoo artists have very high depression and suicide rates. And it's because we're constantly in the presence of people who are suffering. I see. Understand. Because when I do a tattoo, I'm hurting that person. And I can see them. I can feel them tensing up and suffering. And it gets into me. It's impossible to filter it out. And so it's just an example of when you said empathic trauma, I thought of him and how, dentists have a very high depression and suicide rate and drug abuse, and, because they're causing pain. We're not designed to be in the presence of pain, and it's impossible to be around pain without suffering ourselves.
Right. Yes. And this is part of the beauty of being human, right, is that we are empathic and we can feel other people's pain, right? But of course, the other side of that coin is that we can feel other people's suffering too. And there are people who present to me, and they present with all the signs and symptoms of what gets called classic PTSD, and their trauma is vicarious. Right? And are we going to say now the way that it's set up, there's certain criteria, which I think it's inane, that there's a diagnostic system that would say, well, if you came across that vicarious trauma syndrome in a certain way, we'll count it, and if in a different way, we won't, right? I mean, it makes no sense. Like a person presents like that's what's going on in them. They really are depressed. They really do have a startle response. They really are not sleeping. Like, that's real in them, and it comes from a place of vicariousness, right? In a sense, we can celebrate the empathy in humans, right? But we also need to acknowledge that happens to us, and if we don't take care of people when they're encountering suffering all the time, right? I mean, you have to think, why are our oncology units not the places we put the most resources in? Like, as a society, can we make oncology units like 5-star hotels? Like, I bet we could. Right? I mean, we certainly waste a lot of money on on things that, like, millions upon millions of dollars go to that do no good, or for some shallow purpose, right? Or, squandering of resources. Like, why can't we take care of people better when they're in vulnerable places, when they're the patient on the oncology ward? And what about the people who are the nurses, the medical assistants, the nursing assistants, the doctors on those units, the respiratory therapists? Why don't we take better care of them? And we don't value that enough. We look the other way and we put our resources somewhere else, like somebody who buys a new TV when they need a cavity filled. That's how we do that as a society, and like, we don't have to if we stop and think about that. I maintain the assertion that we can behave differently, but it's not in some high newfangled way that's super complicated. It's the opposite, as we come back to the basic simplicity, which has been a theme running through this whole conversation you and I have had, is like the healthy aspects we're talking about are through that lens of common sense evolutionary simplicity, right? And the things that get so complicated and are so hurtful are the opposite.
I know that you're skeptical about medications as an appropriate treatment for something that's chronic or systemic on a cultural level, as am I. But I wonder what your thoughts are on things like MDMA, assisted psychotherapy, or psychedelic psychotherapy. You're in Oregon,
yes.
I believe, where at least psychedelics have been legalized. Do you see a role for these substances in the treatment of trauma or other disorders? Yeah.
So I want to say, I think to do what we do well, one has to know what all the arrows are and have all the arrows in the quiver. Right, so there are times when medicines absolutely save lives, change lives, right? So it's a matter, though, are we using the right tool, right? And we tend to just go to the tool that's easiest and cheapest. That's how our society works, right? So we throw medicines and 15-minute appointments at people. But there's a place for all of this, including what get called alternative modalities. I mean, so they're alternative modalities just because they're not in the mainstream, right? But the research, the data, the clinical experience that's been had in some of the centers that are studying this, and the data and experience from years and years ago, and from the anecdotal evidence from people who are using these methods outside of the systems, right? Which is why I think it's wonderful that Oregon is progressing in a way to put structure and safety around this, because these are modalities that I think have immense, and I don't use that word lightly, the immense potential to help. And I think we see that. They do help when they're used judiciously, appropriately. They're an arrow in the quiver that can really do tremendous good. And part of that is, if I can say one more thing, I'm so sorry. Part of it is through an anti-trauma.
Yeah, sure,
that, to me, has helped me really solidify my thoughts around the role of trauma, because they're so strongly anti-trauma modalities. Right, like that's what they're. When you talk about what are people trying to do if they're using MDMA, or they're using ketamine, they're using psilocybin. Like, what are the aims, right, of the practitioner and the person? The aims, if you look at what are those aims, I mean, it's like distills down to trauma almost 100% of the time. I mean, not always, but almost 100% of the time. That close. So to me, as we get this spotlight on these very powerful helping modalities, it shows us what we're actually treating. right? That we're not treating depression, anxiety, addiction, right? Like those are the branches of the tree. What we're actually treating, if we want to help someone change their lives, is the trauma that's fueling and promoting those things.
Right, and the shame, right?
Yes.
MDMA is also called an empathogen,
Yes.
right? Where the resistance and the anger and all that stuff that's fueled by shame gets diminished enough that you can actually communicate.
Yep. If we're treating trauma, we're going to treat the
it's
shame
very-
it's wrapped up in, right? So yes, absolutely.
Exactly.
Yes.
Well, listen, I've taken more of your time than
It's a pleasure.
than I deserve
It's a
here. But it's been really great talking with you. The book is called Trauma, the Invisible Epidemic. I hope people will pick it up. And I mean, I have to say, look, your publicist reached out to me, and I thought, okay, trauma is interesting. I'd be interested in talking about that. But I thought you would be sort of a conventionally trained psychiatrist, pretty conservative ideas, and I've been very pleasantly surprised at just how deeply and broadly you view these issues.
Thank you. Thanks so much.
Your patients are lucky people.
Thank you. Thanks so much. It means a lot to me to hear that. Thank you so much for that and for having me on.